Some of the reasons are small bowel obstruction, GI fistula, and usually you can correlate it with the patient. Or you have irretractable nausea and vomiting. I had a patient that was prenatal, and it was
they still use that.
TPN,
something gravidarum.
antepartum.
Something gravidarum.
No, it's
Hyperemesis gravidarum. Yeah, you're right.
We got it all
yeah.
It's a tag team here. It is. And so, and then I know that Jennifer, when she's given other educational talks, I guess, she talks about specifically the reason why a lot of people, you think, well, you know, they don't eat, they have, or you might know somebody that has anorexia. A lot of times the insurance won't pay for that. It has to be related to GI. So, anyway, people, I mean, this has got how long will I need to be on TPN? Well, as long as you need to be, until you get better, until you can eat, or it may be and until you and the physician decide. What's in the bag? It talks about macronutrients and micronutrients, and the macronutrients are the dextrose. That's the sugar, the amino acid building blocks for protein, lipids. That's what makes it white, and it's the fat. Water, and you need to have water, obviously, and so a lot of times. The other thing that I do talk about with this weighing every day is the two things that we do want to see happen are a gradual weight gain, and that's what you're looking for, and also you want to be aware of a significant weight gain overnight, say like 3 pounds, because if you do that, maybe your kidneys aren't, you know, we're giving this to cancer patients, so maybe there's a change in their kidney function. And I talked to him about that. You may not, I mean, that might be one of the first signs, a weight gain. You might see swelling.
Do you give them parameters to call the doctor if you see a weight gain within?
I say, well, we do with milrinone.
Yeah.
Yes, we do with milrinone. And so because of that milrinone one,
right.
They say 5 pounds. They say call in 3 pounds overnight. They say 5 pounds in a week. Well, I tell them, and most people are not, you know, they say see 3 pounds, and they don't call the doctor. But I said, you know, if you have 3 pounds the next day, that's 6 pounds. Now, where's that going to go? It may go in your ankles and your fingers, but eventually it's going to go in your lungs. And you're going to end up with some breathing problems. So you really need to
Does it say in there about reiterating the fact that you weigh on the same scale?
No, you just, that's something that you tell them, weigh the same time. And it may say something in here, truthfully. But,
yeah, we'll get into that when we switch to milrinone.
Yeah.
I don't have more than one scale in my house anyway.
And that's really,
someone might say, oh, I forgot, I'm over at my aunt's house. I'm over at, you know, oh, let me weigh here.
Same scale, same time, same place every day. And we do say that with the milrinone. And then, frankly, these folks that are very debilitated on the TPN, they're in bed, they're not getting up, their caretaker is doing this, and they're not really able to get up. And so I do talk about if you see, you know, symptoms of swelling and edema in their hands or their feet or their belly, to be aware of that. The macronutrients. The macronutrients are the sodium, the potassium, the calcium, the phosphorus, trace elements, vitamins, and the vitamins you're going to add yourself. And so I teach them and I tell them, we're going to learn how to do this and we're going to practice, but you will add them, and it's because they're not stable. We give you 7 days worth of medicine or TPN, and you can't add that all at once. You have to do it, and it's stable for at least the 24 hours. And again, we'll practice doing that. The other thing about some people have to have insulin if they're diabetic. Some of the physicians add histamine blockers, Zantac, Xanax in there, and that's again specific to the physician. The other portion of this is that when you're in the hospital, hopefully if you're on TPN in the hospital, you'll notice that they're taking your blood sugar every day. Every day they take your blood sugar. And they do it several times a day. And then some people will say, well, they did it first, but then they stopped. Well, what they're doing is they're checking the sugar to make sure you can tolerate this medicine and tweaking that somewhat. And they decide if you need insulin or not at that time, and that's how they can tell. Now, if you're not a diabetic, chances are you're probably not going to do that at home anymore. But what will happen is at least once a week, your home health nurse does draw the labs. And that's what I tell them. And they do a dressing change, but they'll draw your lab work, and they report that back to our nutritionist, and our nutritionist can adjust your medication as needed and talk with the doctor. Okay, this talks about what are the risks. I mean, that's the next big thing is complications, and it says metabolic. And when it says metabolic, I mean, I talk about, systemic infection is the first thing listed. And it also talks about what are the reasons, and probably the biggest reason is not using aseptic technique. And it actually says proper hand washing, proper cleansing of the caps. And so that out of the biggest thing that I teach during that first 24 hours, or that first teach, is aseptic technique, aseptic technique, aseptic technique. That's because in my mind, we can get you better with this stuff, but you can die from the other. Okay, you can get sick and from this line and die. I mean, and I don't tell them that, but I tell them you can get back in the hospital. So I literally do the happy birthday song twice. That's when you wash your hands. Sometimes we'll get up there. Well, we do get up there. When I'm teaching them, I say, okay, when we get to practice time, we do happy birthday to you, and I sing to them, and they love that. Happy birthday to you. Happy birthday, dear Susan. Okay, and we do it twice. And it's the same with cleaning the hub. That's a 15-second cleansing, and I bet you if I sing happy birthday twice and somebody clocks me, it truly is 15 minutes. So,
Or 15 seconds.
seconds.
We all know what you mean.
Yeah, 15 seconds. Thank you. Yeah, I do say
So
15
that's
minutes, and they're all like,
That's how you teach them to prep their pork?
15 seconds.
And do you just have them use alcohol?
Yes,
Okay.
yes. I have them wash their hands, don gloves, and do alcohol.
Okay.
Okay. Let's see, what else? They also talk about, so it's infection is the big thing, and we talk about signs and symptoms of infection, fever, chills. Let's see, redness, swelling at the site, tenderness at your insertion site of your line. So, and I also talk to them about inspecting that every day. You want to look at that and make sure that it's taped down and that it's not red and you don't have red streaks. It's not hot to the touch. The other part of it is, the other part that I do teach is hyperglycemia and hypoglycemia. And the hyperglycemia is high blood sugar, and we talk about signs and symptoms of hyperglycemia. Well, I mean, in nursing school we knew it was if you peed a lot and you were thirsty a lot and you drank a lot of water.
Bidets. Bidets, dysphagia, dysuria,
Yeah. Oh. Yeah.
What are
The proper terms.
No, we don't say the proper terms. You don't say the proper terms because people don't
Polyuria. No, it's
understand
the
them.
P's. Polyuria, polyphagia.
Polydipsia.
Yeah.
Yeah. Lots of drinking. Now, having said that, if you're going home and you have cancer and you're on pain medicine, guess what you're going to have? A dry mouth. Mm-hmm. You're going to be thirsty all the time. Mm-hmm. You're going to be sleepy all the time.
Itchy nose.
Yeah. So how do you tell the difference? Well, again, with this, we do those weekly labs, and so we can see where you're at. But you do want to be aware of it if you can't wake them up. And again, that can be an overdose of pain medicine. So, but it's something they need to watch for anyway. Hypoglycemia, and this talks about what to do if they're hyperglycemia. glycemic, and they do recommend calling a physician. So, I mean, yeah, they're really all groggy, and you can't wake them up, and they're peeing and peeing and peeing, and they have a lot more out than they do in. Then that's something to be aware of, and to maybe to call the home health nurse or to call your physician. The other thing is hypoglycemia. Well, that's low sugar, and a lot of us who've missed lunch know about low blood sugar, and that's, you get shaky, you break out in a sweat, irritability, and again, a lot of folks who are on this TPN aren't able to take oral. You know, the thing that we learned in school was give them a glass of orange juice with a couple of tablespoons of sugar in it. Well, guess what? If you have stomach cancer, you're not taking anything in. So this book recommends getting the icing in the tube. I always also tell them, I'm sure you can get some at the Wally World, the sugar,
The glucose gel.
and that'll absorb in your mouth, and that'll bring up the blood sugar. And again, you need to talk to your physician, and the reason you do is because maybe you're not getting enough sugar. Something's wrong with your formula. So but treating it immediately, you want to have that on hand. The other thing, it talks about dehydration. A lot of folks that are on TPN have fistulas. We had somebody call today and said, or yesterday, and they said, I've got this TPN going. It's 16 hours, and then they've got water in. I've got as much coming out of, I think, as I do going in. It's not working. And she called up here and talked to Jennifer or Alicia, and Alicia called the physician to see if they could adjust that. And so it is. I mean, you really are being aware of how much are they. They need to keep track of their in and out. And output also means any fistulas or drains. And it talks about prevention, and this talks about maybe it's going in too fast. Let's see what else. Monitor weight, says at least 3 times per week. This talks about it at least 3 times per week. So, again, if you have a drop in weight or an elevation. Let's see. Sorry. Definitions. This book, they have definitions, and that's for your patient. And you tell them, you don't have to read this right now, but you want to read it at some point. And I tell them, hopefully they have an opportunity to read it before the home health nurse gets there, because there's a lot of different terms: air embolism, amino acid, aseptic. What does that mean? Well, I mean, that talks about means of free of bacteria, sterile, free of contamination. I mean, it's words that you hear the physician say, and the nurses say around you. It's doctor and nurse speak, and then you'll know what they're talking about. Home parental nutrition. This is getting ready for it. This book is very redundant in a lot of ways. It says the same thing over and over, but hey, that's what you need. That's what that's what we all need. Oh, that's what I need to learn. So, I mean, some people are like, oh, it just says the same thing. Yeah, it does. Yeah. So this talks about preparing the area. Wash your hands. Wash your hands. Wash your hands. Wash your hands. The happy birthday song, at least 15 seconds, soap and water. It's the friction that gets it off, so you want to hit all the surfaces of your hand. Talks about preparation. You get everything out. This says opening sterile dressing. We don't necessarily have that, but we do talk about, well, we don't. We have them in our dressing change kits, but we don't have them for preparing their TPN. So what I recommend to them, and I get out my handy dandy stuff here, and usually I do it on the nursing bedside table, but they talks about it in the book. Don't use a porous surface. You want to have a designated area. You wipe it. They even talk about starting from the center and working your way around to the outside, getting off any visible contaminants. I use this.
Those are wonderful.
You can use alcohol. It has a third. I think it's like 2/3 water, 1/3 alcohol. You can use that. After I do all that, I say, but really, what I would do at my home is, and I have too many pillowcases at my house. instead of sheets. If I designate those pillowcases as my area to work on, then I can throw them in the washing machine, use the bleach. Nobody use these are mine. Or you can go to the dollar store and get a pack of face towels, and then you have a clean area and you throw them in the washing machine and wash them. And then you always know it's clean no matter, you know, if the cat's gotten on, you turn your back or whatever. Because people have animals, right? So, and usually I get a sheet from the hospital, or not a sheet, but a pillowcase, and I'll put it on the table and we'll work on that. It talks about opening up everything that you need before you start. And again, I go through this book first and then we'll practice. And so you get all your supplies, your alcohol, your syringes, your bag of TPN. You prepare everything. This book even talks about how to prepare the end of your TPN bag, your flesh port, or infusion port, I guess. Not infusion port, not whatever, additive port. I use that's a problem. I don't have the correct words, and I think I might say the same thing 3 times for 3, you know, or say 3 different things for the same thing. But it's the port that you put the medication in. How about that on the bag?
Medication port.
Medication port. Except I call the infusion port the medication port. So that's right. Therein lies the problem. Anyway, it talks about, this book is great. It talks about how to clean it. It says 15-second cleansing on the end of it. And so if they go home with this, get the book out, you know, and let's go through the book again. That's, you know, this talks about how to take medication out of a bottle that you instill air, and we practice with that. I use saline instead of actual vitamins, but I have a show and tell with the vitamins and tell them that's what's going home with them. And so then I go ahead and infuse and let them do it, put the air in the saline bottles and draw it out. And I don't know why. This book talks about using a needle for each bottle. And you can always tell the people that actually read this book, because they'll say, hey, it said I need a needle for each bottle. Because we only send one for the 2 bottles, okay? And you know, if somebody says that, I say, yeah, do whatever they want, right? Send them 2, right? But we do the 1, and these are 5. I usually get 10 cc. I got pulled out the wrong ones. Teach them how to get out 10 cc's out of 2 different bottles, and you know, just pulling that whole procedure of pulling the needle out and that and getting the air out of that syringe, because you don't want to instill it in your TPN bag. And they're looking at me like this is Greek. Y'all have an idea because you're nurses and know what I'm talking about. They're like,
yeah, I gotta do what?
yeah, and it's a lot of stuff coming at them all at once, and they're thinking, and I got to get Granny home, and how are we going to get this, make this, you know, they got a million things going on.
Sometimes you can tell when they're out.
Blank out.
They're just not taking it anymore. It's
yeah, they do, and they really do, and that's why I assure them the home health nurse will be there, and they will go through, and they'll be there for you to do this again. We just want you to have some kind of idea of what's going to happen. Because, again, you'd be stuck again in the same situation if you got home and it was their first time. I can't do this. This part needs a big X in it because our company